Hello, everyone. I see that we have our OGS colleagues joining us, which is great. Welcome, John, and participants joining, so that's great. I'm going to go ahead and get started just so that we can stay on time with this informational webinar about CK2305, Strengthening Training, Evaluation, and Partnerships in the Prevention and Control of Vector-Borne Diseases. Welcome to this webinar. I am Dr. Sue Visser. I'm the Associate Director for Policy and Extramural Program here in the Division of Vector-Borne Diseases, and we're the lead author for this non-research Notice of Funding opportunity. And I am joined by Jeff Borchert, who is our Assistant Director for Extramural Programs, who runs our Extramural Program Office here within the division. And I am really excited to also welcome two great colleagues from our Office of Grant Services who will be answering questions that you may have that Jeff and I cannot answer from the program perspective. From our grants management perspective, John Messick and Benita Bozier Ingram. So welcome to both of them, and thank you so much for your time today. We're really excited about this Notice of Funding opportunity. A few things just to start us out on webinar etiquette and notes. First, this webinar is being recorded and will be made publicly available both on our website and I believe also on grants.gov for future viewing. Please do use the Q&A feature for all questions about the NOFO. We have enabled upvoting, so if you see a question that you also have and you really want to reinforce that so that we can get to it, please upvote on it and those questions will rise to the top and we'll prioritize those for answering early on in our Q&A period. Please refrain from using the chat for questions about the webinar content, but if you're having problems technically, you can go ahead and use that. That'll go to us, the hosts, and the panelists as well, and we'll try to work with you on resolving those concerns. And finally, we'll have a mini web survey that will launch as soon as we shut down the webinar. You'll get a pop-up in your browser asking for just a few simple things, your name, institution, and email address, so we can keep you up to date on any additional resources that might be made available regarding this NOFO. And it's just helpful for us to have an account of who you are, and sometimes the attendee list is a little bit more confusing than we'd like. So for now, we would really appreciate it if in the chat you could just name your institution. Just one person from each institution is fine. If you'd like to do that, that would really help us out just to know who we're talking to as we start the webinar. And while you're doing that, I'll share that here in the Division of Vector-Borne Diseases, which is the host program for this non-research NOFO, our vision is to create a future where vector-borne diseases no longer threaten public health. We are the lead public health agency for the prevention and control of vector-borne diseases. And our mission is to reduce illness and death due to vector-borne diseases. We have 4 goals as part of our strategic plan to accomplish this mission and attempt to achieve this vision. The first is to identify and detect vector-borne pathogens that cause disease in people. The second, to understand when, where, how often, and how people are exposed to vector-borne pathogens. The third is to prevent exposure to vector-borne pathogens and mitigate the consequences of infection. And finally, to implement all the vector-borne disease diagnostics, surveillance, control, and prevention programs that we develop in goals 1 through 3. And this Notice of Funding opportunity is a really great example of us trying to enhance what we know in terms of evaluating prevention and control strategies, training on best practices for the prevention and control of vector-borne diseases, and also making partnerships to allow us to achieve this mission and vision. So with that, if you go on to the next slide, I'm going to hand it over to Mr. Jeff Borchert, who will start describing the NOFO purpose and take you through the content of the NOFO and what we're looking for, and that will be followed by Q&A. Thanks. Take it away, Jeff.
All right, thanks everybody. I'm really excited to have you all here, and thanks for your interest in this NOFO. We're pretty excited about it, and it's really based on building on successes in other parts of our program, including the Centers of Excellence program and the ELC program. The purpose of this NOFO is really threefold. The first was to build the vector-borne disease prevention and control workforce and its capacity. Secondly, to improve adoption and evaluation of vector-borne disease prevention and control programs, tools, and technologies. And 3, facilitate partnerships between academic institutions and federal, local, state, territorial, tribal, tribal public health agencies and other interested parties. And really to break that down a bit more, we wanted to fund organizations that train. So to increase opportunities for students and professionals to receive training in vector-borne disease prevention and control. And for this NOFO, it must include university and college-based students, first of all. And then secondly, it needs to include currently practicing vector-borne disease prevention and control professionals. Secondly, it was to evaluate. So evaluate the impact and effectiveness of non-research existing or commercially available vector-borne disease prevention and control tools, technologies, and programs. And lastly, to build partnerships among institutions and organizations in the vector-borne disease community to accomplish the activities that are proposed in the first two strategies. So the mechanism that we use for this funding is called the Cooperative Agreement. And this might actually be new to some of you, and it's different from funding mechanisms that you might be used to. Federal government uses cooperative agreements as a mechanism when there will be substantial federal programmatic involvement. And so essentially it's involvement of our program with the funded applicants. Substantial involvement means that the awarding office, so us, will collaborate or participate in project or program activities that are all specified in the NOFO, and then your resulting work plan. And this could include responsibility for project management, control, direction, or performance is shared by both our agency and the recipient. And if we need to, we also have the right to intervene, include interrupting or modifying project activities. But oftentimes this is all through just conversations that we have constantly with your group and over the years that we fund our recipients. Additionally, all work plans will receive feedback from our technical monitors and our subject matter experts, and work plans should be revised to respond to this feedback that you get. So the operation of this goal was really to kind of cast a wide net to try to get a lot of applicants that could really kind of answer a number of goals. And so it was to first come up with some that we could fund initially, so a group that we could fund in the first year, but really to create a roster of what we call ABU recipients. And so ABU means approved but unfunded. And this would be a list of grantees that we could utilize in the next 24 months to effectively respond to or manage and address an identified public health threat or some kind of emerging issues in vector-borne diseases. And really, the majority of applicants will likely end up on this list. And so we hope to have a wide range of applicants with high diversity. One of the questions that we got throughout this process was, what's the difference between evaluation and research? And I think this is a really great question. In the field of public health, evaluation is actually distinct from research, and also in many other fields as well. You can find the definitions that we're using at the CDC website on this slide. And so for the purpose of this NOFO, the definition of evaluation is the purpose is to determine the effectiveness of a specific program or model and to understand why a program may or may not be working. And so the goal is to improve programs, to develop specific knowledge about that program and how to improve it. And so it's not just for a program, but it could be like a process, it could be a product, it could be workforce, like the performance of workforce or some kind of policy. And so really it's like program performance, program improvement. And one of the definitions I read really used like the kind of these three words that I think were the best in terms of my definition, which it's like measuring value, effectiveness, and significance. And that differs from research, which really the purpose is theory or hypothesis testing and to produce generalizable knowledge. And so the goal is to contribute to the knowledge base. And so we really encourage you to do your research on the differences between research and evaluation. I mean, we're really hoping for applicants that really understand these definitions. We've had a number of questions where, you know, potential applicants were asking us, they were like sort of pitching a specific project and saying, you know, is this research or is this evaluation? And that's not something that we're allowed to answer. And so we really leave it up to you to figure out those definitions and see how they apply to the projects that you're proposing. So for our funding strategy, as written in the NOFO, we are currently hoping to fund 5 to 10 applicants that will be initially awarded, and this is depending on the need and availability of funds. And I'm going to kick it over here to Sue again to give us a little update on some recent budget items.
Yes, just a quick note that when we published the SNOFO, we did not have our fiscal year 23 budget. The budget has come through and it was less than what we initially saw in both the House and the Senate bills. So we're thinking we'll probably be leaning a little on the lower side of this. But again, as stated in the NOFO, this is depending on availability of funds. So just wanted to point that out since we now have a budget finally for fiscal year 23. Back to you, Jeff.
All right, thanks, Sue. So when recipients apply, we want to be sure that you respond to all the program strategies that are included in the NOFO. So keep that in mind as you apply. Pre-approved organization may be funded once CDC has determined a public health threat exists and funding is available. So this is really tied to kind of that ABU list that we're hoping to put together. So in the future, if there is an emerging need, we can provide additional guidance in coming years that you can then apply to and potentially receive funding. This next bullet here is just kind of the disclaimer, and that's always there could be limited funding available at the time of these announcements. Additional funding will always be contingent upon the availability of appropriations at CDC's sole discretion. As I said, we will always provide additional guidance to that ABU list when it comes up. There's no ceiling on this 5-year funding opportunity, and so there's no maximum amount of funding that we can put out, nor is there a funding floor. So we can have very minimal awards as well if it makes sense to do so at that time. Lastly, recipients may be funded out of rank order, and there's additional details within the NOFO that describe that. So for eligibility on this NOFO, we're hoping for open and maximum competition, and really the strongest applicants will demonstrate the ability to develop work plans that address the following, and that's to improve and standardize vector-borne disease prevention and control training and education for targeted groups and vector-borne disease professional or students. And for this NOFO, we have a couple definitions throughout it that are really trying to capture the types of groups that we're interested in. And so some of that is right here. So professionals and students may include those in are students of the following field: human or veterinary medicine, entomology, vector control, public health, and environmental health. And you'll see some other groups throughout the NOFO as well. We're really trying to be inclusive here on who could potentially be involved. So secondly, we want applicants to be able to increase the number of vector-borne disease students and professionals who are trained to evaluate new and improved vector control programs, tools, and strategies, and to build or strengthen collaborative activities between universities and college community with federal, state, and local agencies. And lastly, we'd like our applicants to reach populations that may be lower income in rural areas and are members of minority communities that might experience higher rates of vector-borne diseases or adverse outcomes from those diseases. So really the target population initially will be different than ones in the ABU program. And so for the ABU, for future years guidance, this could vary depending on the particular public health threat that needs to be funded. This cooperative agreement should always directly impact the health of the public through prevention and control activities within the vector-borne disease field, and seeks to fund organizations that reach the following groups. And so there, once again, is another list of groups that we would like to target, and that includes sanitation workers, hospital, healthcare workers, correctional workers, healthcare workers, purchasing organizations, facility design, engineering associations, entomologists, vector-borne professionals, occupational health and safety professional organizations. So like I said, it's a very, very wide group. So I'm going to go into the program strategies a little deeper. I already read through them in some of those initial slides, but I did want to point out that there will be required activities that we would like you to apply for. And these include, under training, to conduct training and educational needs assessments for vector-borne disease prevention and control professionals and students to develop and maintain readiness across the existing vector-borne disease workforce. Likewise, we'd like to define training and educational goals for vector-borne disease prevention and control, and then of course train undergraduates, graduate students, or postdoctoral fellows. As we mentioned, it's a requirement to train and educate already practicing vector-borne disease prevention and control professionals, and then we would like to see evaluation and performance monitoring and improvement plans to evaluate the impact of these training programs as they're implemented. Secondly, under the evaluate strategy, the required activity is to evaluate the operational use of approved vector-borne disease prevention and control tools, strategies, and programs. The last strategy is partner, and the requirement here is to establish collaborative partnerships in vector-borne disease prevention and control, including relevant partners needed to develop and implement training and evaluation activities. And we have a long list of examples there that include professional organizations, state and territorial and local health departments, as well as a number of federal agencies. But I did want to point out that we do include professional organizations and private industry as potential partners as well. So general work plan guidance, we'd like you to plan your budget around 1.75 million for the first 12-month period. So have a detailed budget up to 1.75 for the first year, and then include a high-level budget for all 5 years. And so it doesn't have to be at the same detail, but needs to map out kind of a general plan for how budgets or how funding will be spent over the remaining 4 years. Plans and activities should align with all 3 program strategies and logic models. And as we mentioned, applicants should be able to revise these plans and activities once CDC reviews or once additional guidance has been put out by our division, depending on the emerging vector-borne disease need. Planned activities should reflect the strategies, outcomes, evaluations, and performance measures that are described throughout the NOFO. And a couple specific ones: references need to be included in the page limits, and there is no required format for CVs and for references. In terms of the application review, it's all mapped out within the NOFO, and really it's all captured right here on this slide. And it covers 3 main areas. It's the approach that you plan to take, it's evaluation and performance management tied to your program, and then your organizational capacity to implement the approach. And I'm not going to go through all these, but I did want to really highlight and emphasize that as you write your applications, to please be writing them to or considering all of these different aspects of these 3 criteria as you author your application, because really this is how you would be scored. And so it would certainly be wise to be reviewing your entire application and tied to this objective review criteria, because this is what we will be using. Lastly, we need you to include a budget. This is not scored within our review, but really it's to what extent are the proposed budgets consistent with the stated program strategies? Does it make sense? Does it tie in well enough in terms of the activities that you've proposed? And make sure that it's adequately justified. We already mentioned about the 1-year budget and then the total budget for 5 years. So really the timeline we're already well into. The NOFO was posted on the 21st of November. We received letters of intent from many of you on the 22nd of December, and we just wanted to thank those that actually sent us those letters. It's very helpful for us to plan a review, to have some sense of the interest in the NOFO, and then to be able to come up with the right set of reviewers and the right review process in the coming months. The webinar is today. It will be recorded, so for those of you that might have trouble getting in, for those of you that couldn't get in, we welcome you as you listen to this recording, because we will get it posted and try to let everyone know. Applications will be due on the 3rd of February, and then we anticipate to put out awards at the end of June. Regarding contacts, you can always reach out to me. My email is here. It's also in the NOFO. We have a new grants person that has already been introduced, and this is Benita. Listed in the NOFO is Frida Johnson, and Benita has just recently replaced Frida. So certainly reach out to Benita. But if you send any emails to Frida, if you're using the old email, that's fine too. I'm sure Frida will get those forwarded to myself and to Benita. And lastly, we'd like to cover a couple of questions. Before we open it up for questions in general, we received some written questions, and our policy, and it's policy like this for all of CDC's mechanisms, is really not to answer these individual questions, but to try to save them and then answer them as a group. So really all applicants get the same information. And so what I'm going to do is I have a few slides with questions that we received, and we have answers that have been both discussed within our program and also discussed with OGS, so that the same answer is available to all potential applicants. After that, we'll have plenty of time to have questions from the chat box. So the first question was this.
And Jeff, sorry to interrupt.
Go ahead.
Just a quick thing on connection. For some of you, you're having a tough time without the full invitation connecting through your computer. So I posted in the chat that full link. You should be able to one-click link that. But knowing that several of you are on the phone, I will read to you the passcode just really quickly if you want to write it down, and then you can shift over to your computer. If you can't, for whatever reason, click on this link from your phones or want to somehow forward it a different way. So the passcode for this webinar with the shortened link is +$9B1 Q3T. So +$9 9B as in boy, 1 Q as in quarter, 3 T as in Tom. So if you want to try to connect via your computers, I know a bunch of you have shifted over already, but otherwise, again, this will be recorded and we'll make sure to make it available to everyone at a later date. Carry on, Jeff.
Thanks, Sue. All right, so questions so far. The first one, there is a lot on training students, including graduate students, but how does CDC reconcile training graduate students when there isn't a research component, i.e. how are students to be funded without a project? Is it expected that they will be funded through other sources or cost share? And this is, goes back to just the differences between research projects and evaluation projects. And so really the funding can be used to conduct evaluation projects, but not research projects. So if you have a grad student that's implementing something tied to evaluation, it could certainly be funded with this type of funding. Second question, can these funds be used to support products for vector control evaluation? It is clear that the project team are not deployed not to deploy any control methods, but they can provide the product and or product expertise to the end user. The answer to that is these funds could be used to procure the vector control products needed to conduct the evaluation. But please note that the applicant may need to partner with a partner organization or an entity that has the authority to use the vector control projects in the jurisdictions. And so that's just goes back to the third strategy of developing partnerships between universities and college, and then state, local, and federal partners. Secondly, the NOFO states implement and evaluate vector surveillance tools and programs. Can you expand on that? Evaluate for what? Effectiveness, adoption? Evaluations of effectiveness or adoptions would certainly be responsive. And so, certainly if you have questions along that line, please go back and review the definitions for evaluation versus research and have a clear understanding of the differences between the two. We also had a very specific question about the IDC rate. And so this is the IDC rate. Is the IDC rate 8%, or should we use the negotiated IDC with the university? Since the NOFO doesn't specify this as a designated training NOFO, and this is identified by the type of program, which is a U50, then the applicant's rate agreement should be used.
And Jeff, and this is John. I just wanted to clarify real quick. Also, I've had a follow-up thought to that also, is that while there is no rate maximum or anything like that, and they can use their negotiated rate, they always can, if they want to use less indirect costs than that, they always can reduce that themselves and request less indirect cost rate if they want to. So that's an option that they want to do if they want to put more funds to the program, to the direct cost instead of the indirect cost. So.
All right, thanks, John. Appreciate that. Next one, would creating and incorporating a business model as part of this grant proposal be received favorably by the CDC, or would this be viewed more like using taxpayer dollars for a commercial gain? We had a lot of discussion about this one internally, and it's okay to include a business plan in a proposal as long as it obviously doesn't conflict with the goals of the NOFO, but also that it doesn't, ultimately generate income for that program. And John can add more information if he wants to. Yeah, there he is.
Anything else to add? And if there's other individuals that want to elaborate a little bit more on the question, originally I had a different response, but then it was more specifically toward the organizational business model. But if someone wants to elaborate it more, then they can do that. But I believe that the answer there, as long as it doesn't generate the program income, then that would be fine, because any program income generated would have to go back to into the program. So.
All right. Thanks, John. Last question is this: if we have an ABU for another co-ed with potentially overlapping activities, but we have never received funding, are we eligible to receive an award through this NOFO? Answer to that is yes. An organization can apply under this NOFO and receive an award. However, once they receive an award, they would need to decline future funds under other ABUs if they are recommended for future funds with overlapping scope. And so I think the key there is we can't double fund anything. And so whether or not you've applied and not been funded under another NOFO, or are planning to apply to another NOFO, we can never fund overlapping activities. So just keep that in mind. I think what's clear kind of with all these questions is we do take them all seriously, and as John sort of alluded to, if there are other distinctions that come from these questions or new questions that come up, certainly reach out to us, and we can answer both programmatic questions and financial questions too with our OGS colleagues. But that is all we had from a presentation standpoint. And so I believe we're going to go into questions from the chat box now.
Yep. And Jeff, I have a couple that I think would be great to answer live. The first one I have is there a list of approved vector-borne disease prevention, control, tools, strategies, programs? And very quickly, I'll just answer no, we don't have a specific list. And there's a couple reasons for that. The first is once we award this, or even after you submit, there's probably additional prevention and control tools, strategies, programs that have been demonstrated to be effective. And so we didn't want to create a single list. And so really your goal inside your application will be to document that these tools, strategies, programs have been determined to be effective elsewhere, right? Because we're not creating new tools, programs, and strategies. But aside from that, there's no specific list. Jeff, do you want to add anything on that?
No, nothing to add. I think that covers it.
Okay. The second question is about the risk assessment questionnaire that is included as a pre-award assessment on page 20. This is section 5 of the NOFO. Asked if it was required for the proposal stage. Now, Nathan, I'm assuming that you mean like at the application stage, do you need a risk assessment questionnaire? And the answer to that, I believe, and John, I just want to check with you and Benita on that, is no. It's just if you were to receive an award before you actually received the resources, you would have to go through the risk assessment process. Is that correct?
No, actually, as part of the application, that is a requirement to be submitted with your application.
Okay.
And that's reviewed as part of the initial part of the applicant organizational review that comes along with that. So if, as it says in the NOFO though, that if you've applied recently within the past 12 months, and you've already done that, then you can provide your screenshots, I believe it is, or something like that. There's a section in there that identifies what they can do if they've already done that within the past 12 months.
Thanks, John. I'm glad I asked you. We're happy to have our OGS colleagues here. Okay, great. A question for you, Jeff. How is operational use defined?
Operational use, I think the way to consider that is to really think about like what's already been approved in terms of products. So something that's been registered already with the EPA, or something that's already commercially available, something that is already in operational use. So mosquito vector control organizations, state health departments, those types of groups are already using something, and potentially you could evaluate how that's used in a different scenario, or are there ways to improve the usage of that, or the operational usage of that program or product.
Thanks, Jeff. Okay, a couple questions, John, that I think are best answered by you. Where should sub-agreement budgets for their partnerships be included in the budget? Maybe under section H, in section B. They're wondering where to tuck those sub-agreement budgets.
This would be under the contractual line item. So anywhere where, if you have a subcontract that you're proposing that, then it would be lined up under that category, that line item category. And if they're talking about the section B on the SF424, then that would be that contractual line item that identifies all of those sub awards.
Thank you. And then relatedly, is the budget itemized list included in the 20-page limit?
That is a good question, and I don't believe it is.
I don't think so.
I don't believe that it is. I think that that's just the project narrative.
That's my understanding as well.
Yeah.
Okay. Is a multi-PI plan required or allowed if there are co-PIs? And I believe we're all in agreement. That's fine.
I think that's okay.
Yes, and just for clarification in grant solutions also, if there would be to an award made, there would be a primary PI listed. That would be the main point of contact, but there's no limit on how many co-PIs there are listed in there. So.
Thank you. Okay, back to you, Jeff. A question about, it seems that the NOFO seems to exclude high school students and children and focuses on college level for training. Is this an indication that training for future vector control professionals or vector professionals is the priority over education to prevent vector-borne diseases?
Yeah, wow, that's a great question. I think, it certainly educating younger students or younger individuals is a priority for divisions, but it's really not a priority for this NOFO. And so really the focus here is to to target community college or college students, but then also already practicing vector-borne disease professionals.
Great, thanks. A question about if there are specific requirements or templates for how we format the performance measurement plan and work plan components, and the answer to that is no. You can be creative in that. Simple is best, of course, we like that, but you can use visuals if you want, tables, images, or text is all just fine. A question in the evaluation piece, how do you define approved? Evaluate the operational use of approved vector-borne disease prevention and control tool strategies and programs. And here again, we're trying to focus on, if there's something that requires regulatory approval, that it already has regulatory approval. We wouldn't be interested in something that is completely has not been demonstrated to be effective or has gone through the regulatory pathway if it needs it. However, we recognize there's lots of programs and strategies that don't require regulatory approval, and those certainly could be evaluated. You just wouldn't want to be creating a new, for example, testing a new insecticide, for example. That would not be consistent with this non-research NOFO, if that makes some sense. Jeff, anything to add on that?
No, I think that captures it.
Okay, can you elaborate on whether a DMP is required or allowed, data management plan, if the data that will be collected is evaluation data and not public health data as defined?
That's a good question that I'm not sure I know the answer to. I would not think that it is public health data. I don't know, Sue, do you have any thoughts, or John, with more experience on data management plans?
Go ahead, John.
I was just curious to say I don't have any additional knowledge on that. Really, I haven't put too much effort into that.
Yeah, I mean, I would assume that you would want at least a brief description of how you're going to manage the data. So a short data management plan would be really important for any of the data that you're collecting for the evaluation strategy. But we can get a little bit more information and communicate back to all the attendees here and post that publicly when we have a little more time to consult. But I would plan for a data management plan for your evaluation data. Okay, is it acceptable for faculty and or agencies to participate on multiple applications so long as activities are distinct? So I'm assuming this would be, you have a previously funded award by CDC, and as long as the activities are distinct, you're asking if you can have faculty and agencies participate on both. So what the NOFO says is that if you have overlapping activities that have the same strategies being implemented. So for us, out of our specific division, one obvious example of this is the research-based centers of excellence. We have two overlapping strategies in terms of training, and also the partnership activities could be overlapping. So those activities would be seen as overlapping, and so those agencies or faculty should be very, very cautious when you're proposing their participation, because it's very likely that those collaborators will have overlapping strategies across both and should not be included. But John can provide maybe more support for how that determination is made.
Well, I was going to add also, just want to make sure that they don't overlap in terms of being the same activities, obviously, but as long as the activities are distinct, then that's fine, as long as the overall effort doesn't exceed 100% in terms of your effort overlap. So you don't want to make sure, you want to make sure that each of them have the identified percentage in terms of your budgeting, and identifying that you don't exceed that 100%, because obviously we don't have more than 100% time on our hands. So so yeah, so just make sure of that. But other than that, it's fine.
Yeah, I see that follow-up question that just came up in the chat about health departments too. And I think the key thing is overlap. I think it's okay for health departments to be involved in more than one application, but the activities need to be distinct, and so it's something you just need to be careful about. But it is okay to play the field. This came up with the COE applications as well, and it's something that is acceptable, but just be careful when you're doing it.
Okay, just a quick note that anyone who's asking questions in the chat, please pop over and enter them in the Q&A. We're not paying any attention to the chat. It's just so that we can manage the questions that are flowing in one spot. So please re-enter them over in the Q&A, and that'll also allow us to publish these questions with answers later on. There's a quick question just to clarify references. Are they included in the 20-page limit? Jeff?
They are, yes, and that's in one of the slides as well.
There's a question about the 5-year budget plan and if that has to be submitted as well. Yes, there's a request for the overall 5-year budget to be submitted as well. You'll submit a detailed budget, as Jeff mentioned, for year 1 and a high-level budget for the other 4 years or fewer. You don't have to propose all 5 if you don't want to.
Would be recommended to propose the budget for 5 years, since the project period is for a 5-year period. So there's a chance that if you don't get, if you're not proposing anything to happen in year 5, then you might not. It might not look good in terms of the reviews and things like that.
Yeah, agreed.
We have a question for the budget. The 1.75 million is for direct costs or total costs? They're for total costs.
Correct. Yeah.
Are biosketches required for senior personnel?
They are. That's, I believe, a addendum that could be attached, but need to double check if it's required or not. We would like to see them. They don't have to be lengthy. There's no format for CVs, but we would like to see them.
Okay. There's a question about who are the key contacts they're supposed to submit on the key contact form. The key contact form.
The key contacts would be the principal investigator and the authorized organizational official, or AOR. I think it's technically the authorized organizational representative, I believe is who it is, the AO.
Thank you, John. A question about if the funds can be used for vector control products, can they also be used to establish a molecular testing laboratory, which would be equipment at a remote, underserved tribal community or health department? So just to make this a little more general, just can the dollars be used to buy equipment for molecular testing?
I think, molecular testing, laboratory testing in general is not a focus of this NOFO. I mean, it's hard to say you can't try to put it in there, but I think it probably does not align with the main objectives or main strategies of this NOFO.
Yeah, it would have to clearly tie back to an evaluation goal, right? If you needed the equipment to conduct your evaluation in some way, that could potentially be proposed. I could see that. But again, like, you need to very, very clearly extend every single activity and every purchase back to one or more of the strategies. Okay, there is a question about, is there a specific definition of what is being designated as a vector-borne disease? Would monitoring disease spread by mice, bats, et cetera, fall under this award? So on our website, we have a listing of all of the priority vector-borne diseases that we handle at CDC. Please note that we consider vector-borne diseases to be those pathogens that are transmitted by mosquitoes, ticks, fleas, and body lice. We don't cover mice or bats, which we typically see as hosts. It's a bit of a technical discussion, but you'll find on our website our target vector-borne diseases.
And we also don't cover Chagas disease, so that's one that's parasitic, and that's not in under our division.
Hey, there's a question. Is there a budget maximum yearly and over 5 years? And we did ask for a planning budget for 1.75 million for that first year, but we did not set a budget maximum for the full 5-year budget. John, anything more to add there?
Usually it's a level funding for that. Obviously, everything's subject to availability of funds from Congress. So if they obviously cut funds and things like that later on, then we have no control. But usually it's level funding. So.
Okay. Another, you mentioned if we cite literature, that's part of the 20-page limit for the project narrative. Is that correct?
Yes.
Yep. Okay. Another budget question. It appears that the budget for the first year needs to be broken out into more than one function or activity. Is that correct?
Could you repeat that? I don't know if I.
It appears that the budget for the first year needs to be broken out into more than one function or activity. So I'm wondering if this is the focus that you have to be responsive to all 3 program strategies of the NOFO. If that's the question, the answer is yes. We want all applicants to address all 3 strategies in the NOFO. That was a requirement. But I'm not sure if that answers the question. SJ Rogers, if you want to clarify if we didn't hit that. Okay, continuing down, can projects include training and evaluation for potential vectors in addition to known vectors?
I think the answer to that would be yes.
A question, John, about how to structure the budget. Can the co-PIs be from different institutions? Which I think the answer is yes. But if so, then how would the budget be addressed?
Technically, that would be the personnel that's listed on the budget are actually staff members. So if it's not a staff member if they're being paid, then that would be a type of consultant / contract type of thing. But or let's see, I'm trying to think other maybe, but usually the PIs are going to be from the same organization. But if there was some type of situation like that, then it would be in one of the other categories, because those main categories of salaries, wages, things like that are for staff members only. So it could be arranged either way. Depends on how the budget is worked out. It could be in contractual or consultants or other, something like that. So it just depends.
I think, we've seen this in other awards where there is a PI from the recipient institution, but then there's subcontracts that include then co-PIs from other institutions. And the clean way that seems to be done is to use the subcontracting mechanism, which is totally fine.
Right. And I would agree. And that would be something that they would just have a detailed budget under the subcontract and then have that person listed as a staff member of that contract organization.
Okay, and then back, John, to the SJ Rogers question, clarifying that they're referencing section A for the budget. Just sort of how to fill out section A if you have multiple staff across multiple organizations and different functions and activities. So I don't know.
For the Form A, that would be the standard form. That's a 424A document. And it would just be lined up across whichever line item it's categorized. And so if you're identifying, say, for instance, we're going back to that previous example where they are co-PIs that are on another contract or subcontract organization, then they would be listed under the contractual for that main recipient, keeping in mind that the main recipient is the organization that is primary for like the salaries and wages and fringe, things like that. So if you're going to be identifying them under subcontracts, then everything's going to be bulked under that subcontract / contractual line item.
Okay. And let me just make sure, SJ Rogers, did we answer that question? Do you want to put one more into the Q&A? Otherwise, I'll open the line for you to just ask the question, clarify. Okay, in the interim, more questions just about the, okay, no, so SJ Rogers still is asking, now contracts are in section B. So I'm gonna open your line to go ahead and talk if you want to.
Okay, in section A, it says it's a budget summary, and it says grant, program, function, or activity, A, and then there's 4 different things that you can list there. And then it has different things on it that also has estimated unobligated funds, federal and non-federal, and then new or revised budget.
Oh, I see. I see what you're looking at. The section A on that one, yes, that's the budget summary I see. That would be the grant programs function or activity that you're identified under. In this category, the CFDA or the assistance listing number, those would all just be one line item that would have the entire amount on there. And then
that's what I was wondering. Okay.
Right. Yep. Sorry about the confusion there. Yep. That's fine.
All right, great. Thank you so much, John. Okay, several questions about the biosketches. People are just interested in a little bit more information, explaining, elaborate more on the biosketches. Is it only for the principal investigators, etc.?
I would say principal investigators and key staff. Certainly not everyone needs to be included. Even you're part of your partnerships, I would just include key staff from each of the organizations that you think are the most relevant.
Thank you. And then several questions on the data management plan. Is there an example, a sample data management plan that's out there that they can use as an example or for reference? Some questions, about the differences between the standards to be used for the collection or generated data versus standards of statement of data standards. Is the standards to be used for collected or generated data? Lots of questions about the data management plan.
Yeah, I think what's best is if we bump that question and we respond in the same spot where we post this on the internet, because I think what it'll do is it'll allow us to look at all these questions, try to come up with some answers and make sure that we get the best information. Because I think that's better than fumbling around on what we know and what we don't know, because we can certainly look into it.
Okay, so stay tuned for more from Jeff on the data management plan, which we'll post with the answers to the questions that we've answered today. Okay, some questions on how the funds can be used. So can we use funds for materials and supplies related to training, such as reagents and consumables for pathogen testing or sampling? And I believe the answer to that is yes. Yep.
Yeah.
Jeff concurs. Can we use funds to provide incentives as part of our strategies? Also read from the NOFO that furniture and equipment is not permitted, but could be depending on the justification. Could you clarify furniture and equipment use?
It's hard to clarify the use. I mean, I think it would just have to be justified, which isn't probably a good answer, but I'm trying to think of an example. I mean, equipment, supplies for training, that's I believe would be supportive, as long as it ties back to the strategies of the NOFO. But I'm having a hard time with the furniture.
Yeah, the only thing I can think of is something like if you have news, like in terms of college individuals or something like that, where you're setting up an office, a small little office or something like that for them to conduct evaluations or conduct the trainings or something like that, or whatever, however you could justify that back. But I guess there are certain situations. That's why we put in there that it could be dependent on justification. So we don't want to necessarily say, yes, it can be, or no, it can't be, but it just depends on how this justification comes in.
Okay, great, thank you. Okay, do we need to include period of performance outcomes in our proposal, or do we select some that apply to our project? And I assume that means the entirety of the 5 years. So period of performance, all 5 versus the first year is the way I'm interpreting that.
Definitely the first year. We would like to see performance measures for that. I think you could speak in general for the remaining years. Certainly work plans change over time, but having like, I think a longer term goal that ties back to the logic model would be something that we would like to see and could strengthen an application.
Okay, thank you. Okay, a specific question, I think, John, this one's for you. This is about the documentation starting on page 26 of the NOFO. Do they need to include documentation regarding item 13, which is funds tracking, item 14, which is pilot program for enhancement of whistleblower protections, and item 15, copyright interest provisions, or are those all post-award components and processes?
Those, I believe, are informational things that are just input for making the applicants aware that these are requirements that you have to follow as part of the application process, like funding restrictions, things like that. And then was the other one copyright infringement provisions? Yeah, things like that that are just required to follow as part of the policies.
And John, while you're off mute, I'll ask another one. Can faculty or agencies participate in competing applications for the SNOFO? So they could they be listed as staff on 2 applications?
They can be, as long as, like we said before, as long as the effort is not overlapping or exceed 100%, then you'll just put in the percentage of the effort that the person is contributing to that particular award. So if you have 4 awards, then it's going to be 25% on each of those awards. So, which then should be budgeted accordingly. So,
okay. A question: can they, if they want to, submit a detailed budget for years 2 to 5?
Of course.
Sounds good, and we know that that changes. Again, the beauty of a cooperative agreement is we can and do expect change to the work plan, and so we can be flexible in revisiting those budgets over time as well. Okay, so if a program was ABU'd from our last round of Centers of Excellence funding on a research cooperative agreement, can relevant projects, trainings, the data management plans be recycled to the SNOFO? And as we mentioned, once awarded, you can't be awarded for something that is identical on another award. But yes, if you have not received funding, for sure, you could propose those activities in this application as well. John, any further guidance on that?
I don't have anything additional.
Okay, thanks. Okay, can we use funds to provide incentives as part of our strategies? Let's start with that part first.
Yeah, I mean, I'm assuming that by incentives, maybe you mean in terms of surveys, and if that's what's meant by that, it might be possible. It's something that we've come up with in the past. There's a lot of reluctance within CDC to support that, but there has been justifications where that's been where folks have been able to do that, and so I think it's something that's okay to propose, but it would be something that we would need to spend some more time looking into if that particular project overlaps into research, and if it doesn't, then would we be able to provide funding to support those incentives?
Okay.
So for incentives, it obviously has to be reasonable. You can't offer, $500 as an incentive for someone to come in off the street and answer a question. So it has to be reasonable. Usually, from my understanding and my recollection anyway, usually like a $25 incentive for somebody to fill out a questionnaire or evaluation or something like that would be sufficient. So it just depends on what's proposed.
Yeah, and I don't think we've ever seen one as high as 25. So
yeah, right.
And just a quick point of clarification, letters of support and bio sketches, they all get uploaded separately from the project narrative. Is that correct?
That's in the NOFO. That's correct. That's the way it's written. Although I don't know how that's done.
John, do you have insight? We're not power users of grants.gov, so could you provide guidance on that?
I believe that that's in this in the I forget what the section is, but I don't believe it counts as part of the project narrative. But
Yeah, definitely not.
yeah, so but I don't think that there's any type of restriction on it. So maybe it's optional documents or something like that. I don't remember exactly what the section is, but
Yeah,
if
I
it's-
would say
if it's-
just
if
do
it's
not
up-
include it in your project narrative. We
Yeah.
don't want it to count against your 20 pages. There is
Exactly.
another bucket, and we can't recall if it's additional resources or optional
Yeah.
documents or something. But if you have trouble uploading that, please reach out so that we can help you.
Right, and then I think that one of the things that we've always kept in mind is that it basically, if it's uploaded, no matter what section it's in, then it's included in the application and it'll be reviewed. So.
And then we are at the top of the hour, so I'll land on one final question. Are you looking for initiatives that are local, regional, or statewide? This was designed to be more regional in coverage, but we have not specified the coverage of the work that's proposed here. So I would say that whatever you propose, you justify it very, very well about the impact and why you've selected the region that you have, whether it be local, more multi-state, or statewide, for example. All right, with that, what I will promise you is that we do have all the rest of your questions. We will take those and provide answers to them when we provide all of the question and answers that we'll include in an FAQ that we will post. We'll follow up with everyone who attended when that information in this recording is posted, so you'll have access to it. And we are so grateful for you joining on and for your interest in the SNOFO. We're really excited to work on it in the coming months as you submit your applications. Any final words from you, Jeff?
No, just thanks everybody. Good luck. We're looking forward to seeing them.
Thank you.
Thank you very much, everybody.
Thanks, John.
Thank
Thanks.
you.